Order. Ms Payne, other question, please.
Thank you, President. My question is for the Minister for Mental Health. The Victorian Alcohol and Other Drugs Strategy 2025 to 2035 sets out a 10-year plan to reduce alcohol and drug-related harms across the state. Now, a significant focus in this strategy is harm reduction in Victoria's health-led, evidence-based approach to alcohol and drug use. The strategy also spruiks the decriminalisation of public intoxication. Yet the strategy is essentially silent on the continued criminalisation of small amounts of illicit drugs, a key component of a health-led response to drug use. So can the Minister advise why decriminalisation is not a key feature of the Victorian alcohol and other drugs strategy?
Minister.
Thank you very much, and I thank Ms Payne for her question, her interest in these matters, and I was very pleased late last year to be able to launch our 10-year alcohol and drug strategy, which is the first of its kind in Victoria, and was also the subject of a lot of consultation with the sector, the workforce, and also those with lived experience of drug and alcohol dependency. And I am proud that we are part of a government that takes a very health-based response to these challenges, and everybody deserves to get that support in a stigma-free, compassionate way. And our drug and alcohol service system here in Victoria, there are wonderful people that are assisting people in the community day in and day out, and around 40,000 people a year access our drug and alcohol services. But it was high time to have a broad and overarching strategy for the sector. There's a few key priorities in the AOD strategy that I know you're aware of, including better information and easier access to services, stronger and increased flexibility in harm reduction and treatment options, culturally safe and determined responses for Aboriginal Victorians. There is a section in the strategy around system innovation and continuous improvement and greater coordination across some of those other key parts of service systems like mental health, housing, justice and other areas. So we certainly have been quite clear that the strategy does not consider approaches to individual substances, including cannabis, and it is a kind of system-wide, holistic view of the sector. So its focus is really more on delivering that compassionate, coordinated and connected system. And we have been clear as a government about our views on decriminalisation in response to the inquiry that the Legalise Cannabis party led in respect to their private members' bill, and we did, in our response to that committee report, outline that the government has got no plans to decriminalise the use of and possession at this time.
Ms Payne, supplementary.
Thank you, President. Thank you, Minister, for your response. And you have touched on this already, but I may as well just clarify. By way of supplementary, another glaring ambition in the Victorian alcohol and other drugs strategy is cannabis. So my question is, will the Minister advise how cannabis fits into this strategy?
Minister.
Thank you, and I thank Ms Payne for a supplementary. I'm not sure I would agree with the way you've characterised it as a glaring omission, because as I was explaining earlier, it is intended for this strategy to be a broad system-wide view of harm reduction, and I would certainly argue that it doesn't matter what substance you're talking about, the principles of harm reduction remain the same. But it's certainly clear in the government's response to the inquiry that your party led our position in relation to cannabis.